Health Call itself has been around since about 2012. We have involved the care home in the development of it. The idea is it's as simple as possible to use, all in one place, and they can just go through the form as they would do on paper, really.
I was first introduced to Health Call about a year ago and been using it ever since. It stopped a lot of time wasting being on the telephone. Often when we were ringing the calls through, we would sit for 10 minutes, maybe longer on the phone, and it stops that.
We've been electronic with our care plans here, so it tied in really, really well. The senior carers were all trained before it came into use. Once they saw it working, it was actually easy for them.
When they were using the traditional method of using the phone, they knew that they could be waiting for a long time for it to answer, whereas now they're able to put those referrals through a lot earlier.
It gives you the instant contact with the healthcare professionals. You know that it's got through to the right person, you get a message back. Sometimes you'll get a phone call to say there's a task for you to look at, and then you can go on and see added to nurse's ledger.
Before, those clinicians just start off at one end of the county, drive to the other and see people as and when they went, whereas now they've got that information, they can make that call as to who needs their care more urgently, and then they can plan their days around that.
The biggest benefit for me using Health Call is it frees me up to do other jobs that need to be completed. It frees us up to be with that resident if they're unwell.
The benefits for the families are that their loved ones are being cared for but have got better access to healthcare. That's given them that reassurance that there is a clinician there that's looking after their relative, even if it is in a remote way.
The staff have more time on the floor rather than them sitting on the telephone. They can literally 2-second job, type it on the tablet, go back to their residents. It saves a lot of time, get it direct to the person that needs it.
The system is very easy to use and all staff got training when it was first implemented.
All they need to do is press one button and then in the background it sorts the rest of that out, rather than them having to use different systems and different processes.
It works with us. We spent a lot of time working with stuff in the background that makes it easier for us to use it.
Providing that News 2 score, providing that set of observations gives those clinicians, when it goes through to them, that information to make that decision as to what priority they see their patients in. We can get information to where it needs to be.
I would definitely say any other care home that was thinking about getting Health Call should go ahead. It saves a lot of time and it's very easy to use.
We're trailblazing in the North East. This is the tip of the iceberg for what Health Call can do. It can be adapted to the organisation that's using it. We can make it so that it fits the pathways in that area.